Dr. Joss Reimer has served as Chief Medical Officer for the WRHA, but for the last year, she put that role on hold to take on the position of President of the Canadian Medical Association. Her term as President of the CMA has now reached a year, and Dr. Reimer will soon be moving on. Joining us now is Dr. Joss Reimer. Good morning, Doctor.
Good morning. Thanks for having me.
Well, thank you so much for joining us. Now, what a year you've had.
Yeah.
Tell us about some of the highlights in the last year serving as president of the CMA.
Yeah, I mean, I feel like almost the whole year was highlights. I really loved doing the work of advocating on behalf of physicians, on behalf of patients. So I got to meet so many amazing people, 3 different health ministers, 2 prime ministers. I just met the king last week, was it? It's hard to even remember.
Wow.
And just getting to be in those spaces where decisions are made, where people are really struggling with what the right thing to do is, that's the highlight for me, is to be able to give people the tools they need to make tough decisions. Any
changes that you were a part of that you're the most proud of?
You know, I loved that they introduced a bill on health data. So there was interoperability is the fancy word we use for it, but the idea is that electronic health records would be forced to talk to each other, because right now, when you go into the hospital, your doctor can't see what happened in another hospital, can't see what happened in a clinic. Now that died with prorogation, so they have to, I hope, reintroduce it, but that was something that the CMA really pushed for. And so I was really proud to see that we were going to have better information for healthcare providers and patients.
Any other highlights for you that stand out?
So many. Working with the health ministers, I got to interview Minister Holland in a fireside chat at a conference. That was amazing.
Cool.
I got to go to Europe, where I met with the German Medical Association and then went to the European conglomerate of all of their medical associations annual meeting, and I got to speak at that event. I went to Azerbaijan, and there was the UN climate conference, and we partnered with the World Health Organization on some presentations on health and climate and the overlap between those two, which feel very pertinent right now in Manitoba with the fires going on.
Yeah.
And even got to go to Colombia, and again we did the UN biodiversity conference there, and then I spoke with the president of the Indigenous Physicians Association of Canada on biodiversity, health, and climate. I could keep going.
Right.
It was such an amazing year.
So much. You did so much in 1 year. Are there things, when you look back, that you wish you had tackled during that 1 year?
I don't know I would have had any more time to do anything else. That was far more than a full-time job. But I'm looking forward to the things that we can do going forward. So we had the apology on behalf of all physicians to Indigenous peoples in September, and it's really critical that we move forward with real action, or else that apology will not just be nothing, it'll be harmful. And so I can't wait to see the changes we make to our ethical guidelines. And this year I had a chance to speak at the on the Parliament Committee supporting the First Nations Clean Water Act, because water is essential for health. And so I really want to see that get built out further. I also really was excited to get to talk to so many candidates during the federal election. Health has not been a big part of the federal attention since we launched the election, and that's something that I don't think it's something we missed, but it's something we're going to have to fight against, because right now economy is top of mind, and getting attention on health is going to be trickier than ever.
The language on health has really changed in the U.S. It's sort of spilling over in some communities here as well. We're seeing a resurgence of measles cases across the country. We're also seeing a sense of anti-vaccination movement. What messages would you like to share with the public regarding this?
It is so hard to make good decisions for your own health, and some communities in particular get bombarded with misinformation on social media, so they really actually target it at certain communities. And when people are trying to make the best decisions they can for their family, when you see that much misinformation over and over again, it really becomes hard to know what the truth is. And so I want people, for measles specifically, get vaccinated. This is such an effective vaccine. It's 97% effective. Almost everybody who's got measles in Canada right now has not had the vaccine.
Okay.
And so we know how well it works. We also know that 10% of the people in Alberta who got measles ended up in the hospital. There's still somebody in the ICU right now because of measles. So this is something that we know we can protect our kids by doing this. It's a really great vaccine. But on top of that, what you were saying with what's going on in the U.S., I'm genuinely really worried about that, because that doesn't respect borders. And when you have people who are intentionally sowing distrust in our institutions, who are saying that we shouldn't be publishing in respected journals, are saying that they're not sure about vaccines, that feeds into Canada. And so I really want to see Health Canada, the Public Health Agency of Canada, take a big step forward in communicating with Canadians to be a trusted source of information.
We're almost out of time already. What's next for you?
I have no idea. Well, not no idea. I've got lots of thoughts, but I have loved doing the advocacy work, and so whatever I do, whether it's back as the Chief Medical Officer in Winnipeg or something else in the future, I will always be advocating for health and healthcare. I loved that work. I love trying to make things better for Canadians. I became a doctor because I wanted to make the world a better place, and I feel like working in this space has been just a dream and the experience of a lifetime.